Agnes, and you're watching MSNBC. Thank you, Lisa. Another health story now. There is a warning out today for people who color their hair. A new study suggests that it could be a health hazard. Some hair dyes reportedly contain dangerously high levels of lead that could contaminate dye users and people and things coming in contact with them. NBC's Robert Hager has the details.
There's been plenty of publicity about lead in paint and lead in drinking water, but lead in hair dye? A study out today in the Journal of the American Pharmaceutical Association says there's a lot of it in some dyes, including heavily advertised Grecian formula, Lady Grecian, and other Grecian products. Also in R&D hair dye and youth hair as well. Toxicologist Howard Milkey of Louisiana's Xavier University did the study.
Well, this was really a surprise to a lot of people. I've worked with a lot of pharmacists, and they had no idea that there was that much lead in these products. And it turns out that that much lead would be considered a very hazardous substance, for example, if it was in a paint can.
Lead has been a concern not for adults, but for young children. Even small amounts can affect learning. The study says there's so much in hair dye, it gets on the user's hands, the faucets, gets all over everything, and kids can pick it up. Even get it from running fingers through the dry hair of a user. But some other dyes don't have lead. Comey's Just for Men, Clairol's Nice and Easy, and others are lead-free. And Grecian, which has the lead, still insists its products are absolutely safe.
The Food and Drug Administration agrees for now, says it's premature to worry. But the Journal of the Pharmaceutical Society isn't so sure. It urges pharmacists to stop selling dyes with lead and to advise customers to buy only lead-free dyes. Robert Hager, NBC News, Washington.
We're going to take a closer look now at the question of health hazards and hair dyes with Dr. Michael Hogue, a pharmacist with the Educational Affairs Department of the American Pharmaceutical Association. Dr. Hogue joins us from our bureau in Washington, D.C. Welcome to you.
Thank you.
I would imagine quite a few people will be very confused by this. On the one hand, there's a warning. On the other, the Food and Drug Administration says it's premature to be concerned. What are we to think about that?
Well, Edie, the FDA is drawing their conclusion based upon some research that was done back in 1980. And at that time that research was done, they actually did a literature review, and there was the toxic level of lead was actually much higher, considered to be much higher at that time than it is now. The federal standards for allowable lead levels in blood when testing the blood of a child or of an adult have dropped considerably since that time. And I think in light of this new information and the new levels that the FDA should potentially reconsider their laws concerning lead-based products.
Now, how do you know if you have a problem with lead from these products?
Well, that is the really tricky part, because in most cases there aren't immediate effects from lead, and in fact a person would not in actually the 99.999% of cases have an immediate exposure or an immediate effect. The long-term effects in children, though, are the ones that are actually the most dangerous. You could have cognitive disorders, mental deficits, and learning disorders long-term in children, so this is mostly a real concern for children and for pregnant women.
But you can't see the lead sometimes, right?
That's absolutely true. And in most of these hair products, when you apply the hair product, the product specifically says not to wear gloves because they won't stain your hands. And that's not a good idea, because when you apply these products, you are actually contaminating your hands with a significant amount of lead, which can then be transmitted to combs, hairbrushes, toothbrushes, anything else that the person that's making this application touches. And therefore, if a child were to pick up one of these items, which toddlers typically do, and put them in their mouth, they have just ingested way above, far above, in some cases 16 to 20 times more lead than they should have had in a day.
Is this a case where some of the hair dyes that have been on the market for a very long time contain lead and that the newer versions of hair dyes don't?
That actually is the case. In fact, I think that in light of many of the recent studies that have been performed on lead in general and its harmful effects on the development of children, I think that many of the new products that have come out have been organic dyes and organically based, and in fact are much safer, regardless of whether further research shows that toxic effects actually occur with these products. It's just a smart thing to be preventative in nature.
How do you know whether the product you are buying is lead-free or not?
Well, it's fairly simple. All a consumer would need to do is actually one of two things. One is turn the box over, and on the back of most boxes and most products is an ingredients section. And about 2 or 3 ingredients into the ingredients section, they will see the word lead acetate or lead. And when they see that, that's a warning that they shouldn't buy that product. The second thing to do is many of these products are sold in pharmacies, and the easiest thing to do would be to approach their pharmacist and ask them to help with an appropriate product selection.
And let us say that you fear that, in fact, there is lead residually in your bathroom, for instance. Can you do anything about that?
Well, it's really difficult. A lot of these lead-containing products actually are very oily based, and in particular on plastics and on the skin. For example, soap and water just simply won't wash them off. I would err on the side of conservatism here, and if you have a toothbrush or a hair comb or a hairbrush that you feel is contaminated with lead, I would throw it away and get a new one.
All right, Dr. Michael Hogue with the American Pharmaceutical Association. Thanks, Dr. Hogue.
Thank you.